Also, Jeff, does Jeff believe Aquaman was flying an aquaplane?
Who, me?
Yeah, I think
what?
it was the military seeing that UFO. And speaking of that,
the only reason I say that, it just scares me more because, look, Jeff messaged another Jeff message,
and I'll read his.
Go ahead.
A high likelihood that the UFOs could be somebody using drones like they do at airports. And I can see somebody thinking, I've got to get a great footage of a warship. If this is the case, I can comfort in the notion that the guy in the audio lost control of his drone and it went into the ocean, and that'll certainly mess with the warranty on that drone.
Oh, sure. It just, if this really is a UFO, means unidentified.
Well,
this is an alien.
It is a
craft.
UFO.
Correct. If it's an alien craft, though, and you see them buzz around and they fly off out of sight into the sky, you think, okay, they went back home. When they go into the ocean, you think, what the heck are they doing here? Right? Maybe?
Yes. Or if they crashed into the ocean, that is possible also.
Maybe they crashed.
Probably more likely.
I also heard Abraham Zapruder was the person who shot that.
Okay. Nice. Andrew,
you want to explain the joke, or
no?
If you have to explain it,
it's not funny.
I also realized
sometimes if you don't explain it, though, it's still not funny.
The Zapruder film was the JFK assassination. I thought it was the guy who shot Bigfoot in the woods.
Oh, okay.
So. So, my bad.
There we go. Todd Furniss is, do I pronounce that properly?
Yeah.
Is the author of the just-released book, The 60% Solution, Rethinking Healthcare, which offers a bold new vision of how to radically improve the availability and affordability of healthcare. And Todd is on the line now. Good morning.
Good morning. I got to admire somebody who can put Zapruder and Bigfoot and COVID in the same sentence.
Well, Bigfoot was at the scene of the...
Okay.
He was on the grassy knoll.
Right.
He was the guy holding the umbrella, so nobody could see all his hair.
Oh, Lord. Okay, so the question this morning, Todd, is vaccine and the anti-vaxxers and the vaccine skepticism. Are we in a position where we could be losing our opportunity at herd immunity?
Well, I think you got a question. That's a short sentence with a lot of questions.
Yeah.
So I think there's a question about what is herd immunity, and I haven't heard a consistent answer. But I think the other question is where do we stand right now?
Yeah.
And where we stand right now is over 45% of all adults have already been fully vaccinated. The number of people who've gotten their first shot, which means they should be 70-80% protected already, is north of 65%. And if you look at people over 65 years old, that number is over 70%. So if you add that number to the number of folks who have already had the virus, which is about 10% of our population, you're getting pretty close to a big number. And then you also got to question, what about people who have just a natural immunity to it? And then lastly, you got to say, hey, what about some people who just shouldn't get the vaccine, like women of childbearing age or young children? Mm-hmm. So I think there's a question around, hey, we may have already gotten past the threshold. And I think that the whole commentary around herd immunity is such a moving target that it's not really a credible argument, at least from my perspective thus far.
Well, you bring up a couple of interesting points that are not considered. We're so black and white with everything, it seems, right? But you forget about the fact that there are people, we believe, there's a lot that we don't know about this virus, but I believe there are people out there that are immune to this. There are countless stories of a family of 5 testing positive for the virus, but one of them, of the 5, never gets it and continues to test, but continued to test negative. So why is that? Is it possible that there is an immunity to the virus? And then there are the people who have had it, like a couple of us here in the studio. How long is our immunity going to be good for? So there are other factors that I guess are promising towards us reaching that point of a safe level for what we can call herd immunity.
Well, and I think this is why you got to stay in touch with your primary care physician and make sure you're doing the right things to the extent that you can. It's funny, when we were growing up, at least my mom was very good about this. She would, wail on me all the time, saying, "Hey, you need to eat right, sleep right, and get some exercise. Go out and play, for gosh sakes."
Right.
And at the end of the day, all the studies show that if you do those three things, then your chances of either getting the virus or suffering from the virus disproportionately are likely to be diminished. So the real issue is, take care. You got to take care of yourself. Stay in touch with your primary care physician. I write a lot about this in my book, and then. And do smart things with regard to the decision making you're exercising.
So, in your book, how do you rethink healthcare? What's the and I realize it's a book, but in a nutshell, what are you saying?
Well, I'm saying that there are 5 major components to a system called the healthcare industry, and that they work together. And we need to fix these 5 things. We need to change human behavior to go engage with their primary care physicians more and stay ahead of care, so it's preventative in nature. That's not a new idea. We need to fix the systems that prevent us from really understanding price, and we need to, which are different from the pricing transparency issue, but just the systems themselves, like accounting and IT, that prevent us from moving and having true competition from one physician to another, or one healthcare provider to another. Third thing is we need to have pricing transparency, and then fourth thing is we need to really elaborate or expand the way we use health savings accounts to create more tax-advantaged money. And then fifth, we need to just do whatever we can to get rid of some of this hyper-regulation of an industry. We have so many people in bed with us when we go to the doctor, we don't even realize it. So, for example, real quickly, right now, United Healthcare is buying physician practices. This issue is largely flown under the radar screen from the national media. But that means that when you go to the doctor, you don't know if you're going to the physician, to the clinic, to somebody affiliated with a hospital, or somebody who's working for the insurance company. And the insurance company, what they're doing is they're saying now all of a sudden they're saying, we're not going to include any more doctors in our network. We're going to reduce the reimbursement rates to our doctors who are already in network, and we're going to drive all the traffic we can to employed physicians, and we're going to control the referral network.
Yeah.
So all of that, to me, just screams anti-competitive behavior.
Yeah, you're not. It's not thinking about what's best for the patient. Maybe what's best for the insurance company or for the business.
Right. Which really what's best for the shareholder of the insurance company and the CEO.
How much have lawsuits played a role? Healthcare lawsuits, to the point where, when you walk into your physician, you have a lot of restrictions that are imposed by insurance companies, but also I think attorneys have played a role in this as well, saying here's how we're going to protect the hospital network. It seems like the physician today, it's all about paperwork and massive amounts of paperwork.
The average number of nurses per doctor in certain major metropolitan areas now is between 7 and 9. And most of those folks are simply doing scheduling and claims processing.
Wow.
So you're spot on. And that's one of the big areas that I talk about in the book also, which is just the amount of unbelievable waste that exists in the model. And the reason for that is because we don't have consumerism in the industry. If I said to you, hey, Bo, I'd like you to understand what the price of this is. Your answer would be, well, your copay, ... or your deductible, ... It's not the price. That's just the amount that you have to come out of pocket.
Right.
Or that I have to come out of pocket. And so we're not asking the right questions anymore. And one of the things that I've advocated is that we put more money into HSAs and create more consumerism in the marketplace. If I got to be king for a day, which God forbid, would be fun, but what I'd want to do is give ultimately 100 million soccer moms $10,000 at the beginning of the year and say, whatever you don't spend during the course of this year, you get to keep. You would see a level of negotiation in the industry unparalleled and unrivaled, because moms make about 95% of all healthcare decisions for the entire family, and so they're going to do what's best for the child or the loved one, and they're going to be very, very pecunious about how they spend their money.
Very interesting. And, you know, we're a society that really doesn't pay attention to you. You're right. We pay attention to our copay. Medicine costs $20, right? That's what your copay is. You have no idea what it really costs.
So I'm going to have I'm going to have a knee replacement because my out of pocket's $20. The surgery costs $35,000 or so.
Right.
But wait a minute, my out of pocket's $20, so I'm good with that.
Yet I don't know that I want to be in a position where I'm looking for the cheaper deal. This one's going to do it for $19,000,
and they'll throw in lunch. Oh my gosh!
I guess we got to find a happy balance in there.
Well, it would not surprise you that there are emerging organizations that do quality assessments of the physicians for all of these practice areas. And they're now able to take data that comes from CMS and from other organizations and then triangulate and say, all right, here's the best value, meaning the highest, the lowest price and the highest quality available. And so those metrics exist, and you can make a risk-based decision. It's kind of like saying if I said to you, hey, you need an oil change. Now, I don't know about you, but I knew how to change the oil when I was 16. It was a VW van. I couldn't even tell you what the heck is going on in my Audi A8, right? So, but I do know how to evaluate whether or not to take it to the dealer versus take it to the Jiffy Lube. Right. And I can say what are the benefits and detriments of going to the dealer versus the Jiffy Lube, and I'm willing to make that decision. And it doesn't mean I'm always going to go to the dealer. It may mean, hey, I'm at 3,000 miles. It's time to change the oil. I'm going to pay $20.
Yeah. Very interesting. All right, Todd. The book is I'm assuming is all over. The 60% Solution: Rethinking Healthcare. I'm assuming wherever you buy books, it's available.
That's right. I'm encouraging people to go to Amazon or Barnes & Noble. They're great outlets, and you can get them right away.
Okay. Todd, thanks so much. We'll do it again. We appreciate it.
Thanks so much. I enjoyed it.
Okay. Todd Furniss. The book is The 60% Solution: Rethinking Healthcare. You got to wonder. I mean, you don't... You just look at your bottom line. This is what I pay, right?
There's no question.
But I agree with you on this whole deal where, the competition thing is great, but how far are we going to go with this?
Absolutely. And as you mentioned, you look at the bottom line. I had in January a procedure to clean up my knee a little bit. And I was actually last week fighting with one of the billing offices, because the way it worked was, like, I got a bill from the doctor, I got a bill from anesthesia, I got a bill from the place where the surgery was held in, right? You get like 4 different places send me a bill. Well, one of them, for some reason, I think this is the reason, because in most cases, and it is here, your insurance is like January to December. Well, my procedure was done January 7th, the first week of January. So as I was visiting and going through all these procedures, I had insurance for 2020. My card, I still had insurance, but it rolls over on the 1st. So they didn't have my new card with my new code and my new account number.
Right.
So that one particular bill didn't go in through insurance. It was like $3,500 that I got in the mail. And so I'm fighting with them to go through the insurance, but it's your outlook on whether or not it was worth it was like, wait a minute, I got to pay how much?
But what is interesting, though, is when you bought your vehicle, or you bought, the chainsaw that you used to cut up the wood for your fire pit, you probably looked at the price. It's like, well, I can get this one for, $79.
Right.
Versus the $149 they want over here. I'm going to get this one.
Correct.
Did you know how much that surgery was going to be before you went in? Your little cleanup on the knee? Did you check on it? No. We never do. That's not something you normally do when you walk into so you're going to get a knee replacement, or you're going in for cancer surgery. I had no clue what that was going to cost. You don't ever, it's not like you ask.
Well, but in that case,
because I could get it done over here for about $2,000 cheaper. We never do that.
No, but
I'm not sure we should either.
The cancer thing is for real. I'll tell you, I have a piece of glass still in my foot. There's still a piece of glass in my foot. I've had 3 pieces removed, all by civilians who I'm like, hey,
his neighbor is like, yeah, I'll cut that open for you.
But it's still in there.
Well, there's at least one more. There's at least a 4th piece in there. But I'll tell you, the reason I don't want to go is because I know the routine. I am factoring money here, where I've had 3 pieces removed by people who just, one of them works in at a local medical office, but she's not a doctor or a nurse. But it's like I got to pay $60 to go see my specialist, my physician, so they can refer me to a specialist who's probably going to send me to a third place. Well, how much am I going to pay to get this piece of glass out?
I'm not saying we don't consider the cost, because we do, but we don't say, and how much is this going to be? I just want to...
That is true.
Because I'd like to get a second opinion on...
On my way over here, I saw the other urgent care in the window had a buy one, get one special. I don't know. Do you guys match prices?
Exactly, yeah. We don't. And it's almost kind of like what he's saying there. I know we're taking it to a bit of an extreme, but I'm not sure we want healthcare to go there.
I completely agree with you. I completely agree.
And maybe a little more, it's a little more competitive. That would be a really nice thing, but I'm not sure we want to go all the way with it.